Have you ever heard the computer systems just don't talk to each other? This is a really common statement all over the world in terms of digital health. Now, in this video, we're going to go over some key points about interoperability, and I've built this specifically for nurses, doctors, administrators, project managers, new folks to the technical healthcare industry, as a way of quickly explaining the two key things you need to know about interoperability. My name is Grace Potma, and I'm Director of Product for OpenMRS, and you are welcome to reuse these slides with your colleagues if you find them helpful. So the two things we're going to cover are the importance of coded terminology and data standards in a simple example. Let's say you have system number 1 and system number 2. System number 1 might be at a specialist's office or some other smaller location or bigger location. System number 2 is somewhere else. These two computers are not physically connected. They might be using the same software or different software. The key point is that they want to share information with each other. Let's look at this case example. Imagine that Mr. John Smith has these three conditions: asthma, type 2 diabetes, and tuberculosis. We want to know that in system 2. Now, often, different pieces of software are encoding information in their own unique codes. This is often very appropriate because it keeps things well established and separated. However, if you try to share these unique codes, these representations of these three conditions, over to system number 2, it will have no idea what these codes mean because it has no reference for these codes. And this is where the importance of shared language or a shared dictionary between systems really becomes so key. Let's look at this again. Now, there are international standards such as ICD, SNOMED, and others that represent conditions and other pieces of medical information in a coded or dictionary type of way. These are also often referred to as medical terminology. So in this case, these are the three ICD codes for these conditions. Now, when we send these conditions over to system number 2, system number 2 says, you know what? I know those words. I know that that's the code for asthma. I know that's the code for diabetes, and I know that's a code for TB. But the system doesn't know what to do with it. Why not? Why didn't that work? Well, let's just imagine a human example. Someone comes up to you on the street and says, "Hi, asthma, diabetes, tuberculosis." Well, what would you be thinking? You would say, "Okay, I know those words, but I don't know what you want me to do with that, stranger." It's the same thing in this situation. And that's why we need the second key piece. We need not only a shared dictionary, but also a shared data standard for how we structure the data, also known as shared grammar. So for example, we are sending this message over. This is a really simple example of how this might look using the international standard created by the HL7 community. The FHIR community is very welcoming and has worked very hard over the last more than 10 years to create a shared way, a shared standard for how we can represent and structure the grammar of healthcare information so that we can send it from one system to another. So how would we represent that there's a patient named John Smith with these conditions? Well, look at this example. You can see those three codes that we looked at earlier. That shared dictionary is represented here. But you can also see that there's a structure to this, a data structure, some grammar. We are specifically telling system 2, there's a patient, this is his name, and the following things are conditions that he has. And now system 2 can say, aha, okay, you're telling me there's a patient named John Smith with these three conditions. Got it. So now you know the key 2 building blocks to interoperability. Again, if you find these slides helpful, you are very welcome to recreate and reuse them. Here is a short link where you can find these slides publicly available. If you're looking for more information to learn more about FHIR, I highly recommend this video by Mr. James Agnew from the Smile Digital Health or Smile CDR team. If you're looking for more information on Open Medical Record System, OpenMRS, and how we use FHIR, we have information at om.rs/FHIR101. And you can read more on how we approach FHIR in our open source medical record system for low resource settings. I hope you've enjoyed this video, and if you found it helpful, please like and share.